Professor Heidi Janz.
Honorable Senators, thank you for the opportunity to speak to you today. Ableism is discrimination against people with disabilities based on the belief that typical abilities are superior. Like racism and sexism, ableism classifies entire groups of people as less than and perpetuates harmful stereotypes. Ableism remains, in the words of Canadian disability scholar Gregor Walbering, one of the most societally entrenched and accepted isms. The plan to expand MAID legislation is an example of ableism. Research indicates that people with disabilities frequently encounter discrimination in healthcare settings, even in ordinary times. Studies have consistently shown that healthcare professionals substantially underestimate the quality of life of people with disabilities. Erroneous judgments about the quality of life experienced by people with disabilities can result in their treatment options being either limited or altogether eliminated. At the heart of such decisions is what disability scholar Joel Reynolds has termed the ableist conflation of disability, suffering, and death, running contrary to the ubiquitous public health mantra since the pandemic. "We're all in this together" has been the development of critical care triage protocols which list the pre-existence of a disability as an exclusion criterion for critical care, if rationing becomes necessary. Hence, when I became critically ill with pneumonia in November, I was forced to go into ER alone and terrified. Over the years, I'd heard numerous accounts from friends and colleagues with disabilities who have had DNR orders arbitrarily placed on their charts without their knowledge, and who consequently needed family and friends to monitor their charts for the appearance of unauthorized DNR orders, and to advocate for their removal. Others recounted how physicians asked, repeatedly, whether they would want interventions such as receiving supplemental oxygen through nasal cannula, treatments that would generally be considered routine for non-disabled people, and then being asked, again, "Are you sure?" It was with all these things percolating in my mind that I preemptively responded to the doc's inquiry about goals of care with all the clarity and force that my 82% oxygen-saturated lungs could muster. R1. I soon became accustomed to hearing myself described in the following terms at every shift change: complicated pneumonia, R1. But then came the day that I went for a CT scan. Two nurses in radiology were looking through my chart, when one looked at the other and exclaimed, incredulously, "She's an R1," and shook her head. Any ostensible status I have as an ethics professor or a disability rights advocate was instantly stripped away. and I became a presumptively nonverbal, spastic quadriplegic, who already had a feeding tube, and now had complicated pneumonia. It was clear from this nurse's reaction to my goals of care that she could not imagine my life to be worth living. This is what medical ableism looks and feels like. I had a friend with disabilities who, after being forced to live in a nursing home, and hearing, "She's an one too many times," changed her goals of care, agreed to forego what would otherwise have been routine treatment with oxygen, and died. This is what medical ableism, internalized, does. People with disabilities are at a higher risk of suicide due to systemic and internalized ableism, yet they face substantial barriers when trying to access suicide prevention services. Medical professionals overlook typical sources of stress. Problems arising from relationship breakdowns, depression, and isolation are wrongly attributed to disability. News reports indicate that some people with disabilities living in poverty are being driven to end their lives through MAID, because they lack the means to survive. Physicians report that patients with disabilities are requesting MAID upon learning that the wait time for accessible housing with the supports they require is 10 years or more. In a truly just and progressive society, suicide prevention measures should be applied equally to all people. Given the prevalence of ableism in Canada, the Council of Canadians with Disabilities urges that the following amendments be made to Bill C-7 in hopes of limiting the bill's capacity to cause death through ableism. 1. Receipt of adequate housing, income support, palliative care and home-based services must be prerequisite eligibility requirements for MAID. The onus for providing these supports at the level required must fall on governments. A person with disabilities should never bear the burden of trying to lobby for adequate supports. 2. Refer to the Supreme Court of Canada, by way of constitutional reference. Bill C-14's existing protections limiting MAID to cases where a person's natural death is reasonably foreseeable. 3. Any changes to Canada's MAID law must meaningfully respond to the 2019 End of Mission Statement of the United Nations Special Rapporteur on the Rights of Persons with Disabilities, wherein Ms. Catalina Devon-Aguilar cites a lack of protocol to demonstrate that persons with disabilities have been provided with viable alternatives when eligible for assistive dying, and notes that she received worrisome claims about persons with disabilities in institutions being pressured to seek medical assistance in dying, and practitioners not formally reporting cases involving persons with disabilities. 4. Canada's amended MAID law should follow the judicial directive of the SCC in Carter, which required a carefully designed system that imposes stringent limits that are scrupulously monitored and enforced. 5. Remove Bill C-7's provision allowing a disabled person's health care or personal care provider to be an eligible witness to that person's request for MAID. 6. Retain Bill C-14's mandatory 10-day waiting period requirement, as it currently stands, and the requirement for independent verification of all MAID requests by 2 witnesses. 7. In response to the prevalence of medical ableism, add language to Bill C-7 that will ensure that all discussions surrounding MAID are patient-led and not prematurely initiated by the physician. 8. Remove Bill C-7's provisions waiving Bill C-14's important and necessary final consent requirements. Proponents of Bill C-7 claim that the expansion of eligibility and the dismantling of safeguards for MAID that it prescribes will enhance the autonomy and dignity of people with disabilities. But, in reality, Bill C-7 will enshrine a lethal form of ableism into Canadian law by choosing to focus policy efforts on facilitating the death of disabled people rather than ensuring the provision of community-based supports to assist people with disabilities to live. The role of the Senate is to provide sober second thought for legislation that will impact our future as a country. The Council of Canadians with Disabilities, along with the entire disability rights community in Canada, is therefore pleading with you. Fulfill your duty. Do not pass Bill C-7 in its current form. Send it back to the government with amendments that respond to the reality of systemic ableism. You must ensure that MAID does not become medical ableism-instigated death. Thank you for your attention.
Thank you very much, Professor Janz, for sharing your remarks with your thoughts and remarks with us. We all appreciate it. We will now go to senators to ask questions. Senators, please direct your questions to the witness you want the answer from. And may I tell you that, please inform you that you only have 5 minutes, which includes the answer. So please do use your